Give us your name and where you're from.
My name is Bill, and I'm from Garner, North Carolina, originally from Rochester, New York. I've been living in the area here for 6 years.
I understand that you have a chronic illness.
Yes, I do. I have chronic pain, and I also have a condition called an acoustic neuroma, which is a spot on my brain and my hearing canal, which gives me ringing headaches called tinnitus, and also affects my balance. And I just there's really not much pharmaceutical medications can do for me.
Why is that?
They just don't seem to get they just don't seem to help. I'm unable to get a strong enough dose of anything. Just as my doctors will not prescribe anything that they might be able to be of help. But then on the other hand, I'm also reticent about taking anything that's too much of a narcotic, because I know how narcotic medicines work, and I don't want to get involved in any of that. I've been through that, and it doesn't. It's just not a good way to go. I find that smoking cannabis helps relieve the conditions that I have as a result of just genetics. It helps to relax me. It helps to relax me.
But tell me, what kind of medications were you on before?
I was taking Demerol. I was taking codeine tablets. A number of non-narcotic medications that were very ineffective. I was taking Prozac, which didn't agree with me. You know, I was.
That's something else I was going to ask you. What kind of side effects were you having from the?
The side effects were terrible. You know,
really? Like what?
The Prozac gave me made my neck numb. I thought I forget the clinical term for it. I think it's called neurasthenia or something like that. But it just didn't seem to work out for me. You know, and it's not so much that I was depressed. It's just that they were trying to find something that would work for me, and they were trying to keep me away from heavy narcotic medications.
Well, I imagine there's probably a number of people out there that probably don't realize that antidepressants are used to treat more than just depression. They use them to treat a lot of other things. With fibromyalgia, like in my case, they often gave antidepressants as well. So.
Well, they're used to treat anxiety, and I just never. I've always been kind of an anxious individual, but I realize that some of that is natural, and I didn't like the fact that they had a medication that would prevent you from just feeling everyday life, the feelings that you get as being, you know, just the changes that you go through during the course of your life. You know, I didn't like being, I didn't like that feeling. You know, something doesn't agree with me, I'm not having it.
So you decided to try cannabis to treat your symptoms?
A lot of people I knew growing up smoked cannabis, and I got involved back into it, and it just provided relief for me, you know. And I'm a cancer survivor.
Tell us about that.
Well, 16 years ago, this past February, I was diagnosed with lung cancer, and I've been surviving now for 16 years. And I was in the hospital for almost 10 days, and before they let you out of the hospital, the surgical team gathers around you, and the doctors, the anesthesiologists that were involved in the surgery, they tell you what they did and what the cause of the cancer was. In my case, they said the cause was cigarette smoking. And then I started asking questions of my own, and I asked them, I said, well, what about environmental concerns? Because I grew up in upstate New York, and there was a lot of chemical dumping up there, and there were environmental issues all throughout that area. And I asked them, what about marijuana and what about hashish? And they, the surgical team just kind of looked at each other, and they said, well, there's no nicotine in marijuana and hashish. Nicotine is the substance that gives you lung cancer. So they really couldn't endorse the use of cannabis, but they couldn't say that it was a direct cause because of my college days when I smoked marijuana. And so I thought that was interesting. And after a follow-up visit to the surgeon that performed my operation, he just said, go and live your life. And I tried to, but I found out that when you're missing a portion of your lung, it's kind of hard to carry on, especially if you're doing warehouse, if you're working in a warehouse, which I did. It's hard, and people treat you differently too when you're diagnosed with a chronic illness. You're all of a sudden, you're not going to get promoted anytime too soon, and people just naturally treat you differently. And I didn't like the vibe that I was getting at work, and I didn't see any future where I was, so I decided to just file for disability, and was fortunate enough to be able to get it. And I've lived my life as good as I can. I volunteer right now at one of the local hospitals here in the Raleigh area called the Rex Cancer Center, and it's very rewarding work for me. Patients will come in, and I give them access to printed resource material. We give out wigs for women that are experiencing hair loss as a result of chemo and radiation. And I am around a lot of people that could benefit from the use of cannabis, but I'm not a doctor, and Rex Hospital is a very conservative organization, and I have to be careful what I say. In other words,
it's very frustrating, isn't it?
Right. I'm unable to suggest if someone is having difficulty eating, which a lot of people experience as a result of chemo and radiation. Myself, I was fortunate. I had the surgery, and I had no follow-up chemo and radiation. I was just, I was very fortunate. My life has been such, and I feel good about being able to give back to the new community into which I live now, and it's very rewarding for me to help people. The information that I give, though, has nothing to do with cannabis, because I want to be able to not be. I'm a volunteer, okay. And as I said before, I am not a doctor. I can't say, try cannabis, might improve your appetite. I see a lot of people that are wasted from just chemo and radiation, and they would benefit from the use of cannabis, because it does help stimulate your appetite.
It would be nice if you could tell them about it, wouldn't it?
Yes, it would.